Hello, I'm Jan Boarman, and this is my full head-to-toe assessment video for my advanced health assessment class. This is Miranda, and she has volunteered to be my patient today. Before entering the room, I had her empty her bladder and put on a gown. I obtained a full set of vital signs, height, and weight. I assessed her visual acuity using the Snellen chart for distant vision and the Rosenbaum chart for near vision. Both were 20/20, and that was assessing cranial nerve 2, which is the optic nerve. As she was entering, I noticed she was dressed appropriately, her gait was steady, her speech was clear and articulate, her mannerisms were appropriate, she was alert and oriented ×3 to person, place, and time, and she looks well nourished and appropriate. Upon general inspection of the face and head, I'm noticing symmetry of the eyes, ears, nose, and mouth. The head is normal round, normal, cephalic. I don't see any signs of masses or lesions. The color is uniform throughout. I'm going to palpate for any masses or lesions. The skull is freely movable. Any tenderness? No. I'm also checking the texture of the hair, whether there's split ends or not. I'm going to palpate the facial bones, frontal sinuses for any tenderness, maxillary sinuses, the temporomandibular joint, open and close, open and close. I didn't hear any audible popping, and I didn't feel any clicking or popping as I held my hands on the temporomandibular joint. Now we are going to do assess cranial nerve 5, which is the trigeminal nerve, and we're going to do some light sensations. I want you to close your eyes. I want you to tell me if you feel this and if you feel it equally bilaterally on each side. Good. Now we are going to test cranial nerve 7, which is the facial nerve, and I'm going to have you make some faces. I want you to raise your eyebrows, close your eyes tight, smile, clench your teeth, puff your cheeks out, stick your tongue out. Good. Now we are going to move along to the eyes. Upon general inspection of the eyes, I noticed that the eyes are both symmetrical. There are no signs of masses or lesions, ptosis, or any drainage. The eyebrows are full and manicured. The eyelashes extend outwardly, both bilaterally. The sclera of the eyes are white, intact, with no lesions. I'm going to pull the eyes down a little bit and look at the sclera conjunctiva. They are pink and moist and no erythema. Now I'm going to check the pupil reflex using a pen light, and I'm looking to make sure the pupils are equal, round, and reactive to light and accommodation. Direct and consensual. Direct and consensual. Good. Now I'm going to palpate the lacrimal apparatus, and I'm checking for any type of tearing or excessive exudate. Good. There is none. Now I'm going to do the cover-uncover test, and I'm checking for any abnormal movements of the eyes. I want you to stare at an object straight ahead and cover one eye. Good. Other eye. Good. Now I'm going to test cranial nerves 3, 4, and 6, which is the oculomotor, trochlear, and abducens, and I'm checking for any extraocular eye movements of the eyes or any nystagmus. And I'm going to do this checking and testing with the 6 cardinal gaze. I want you to follow my finger. And convergence. Good. Now I'm going to inspect the red reflex with the ophthalmoscope. I'm going to test her right eye with my right eye starting at 0. I want you to just look at my nose. Red reflex is present. Left eye with her left eye starting at 0. Red reflex was present. Now I'm going to move along to the ears. Upon general inspection of the ears, I noticed that the ears are both symmetrical. They're not low set. The top of the ears meet the outer canthus of the eyes. I don't see any signs of masses or lesions. The color is uniform with the rest of the body. I'm going to palpate the auricles for any masses, lesions, any tenderness, and they are firm and normal. I don't see any drainage from the ears. I'm going to look in the ear canal and tympanic membrane, and I'm making sure that it is clean and clear, no signs of infection or excessive cerumen. The tympanic membrane is pearly gray. The bony structures are seen with no bulging or redness. The light reflex is present, and I would do the other side as well. Now I'm going to do some hearing tests. I'm going to test cranial nerve 8, which is the auditory nerve, and I want you to cover one ear, and I'm going to go behind you and you say the word I whisper. Apple. Purple. Good. Now we are going to do some other hearing tests. With the tuning fork, I'm going to do the Weber test. I'm going to strike the tuning fork. I'm going to sit it on top of your head, and I want you to tell me if you hear it equally and bilaterally in both ears. Yes. Right? Now we are going to do the Ren test, which is checking air conduction versus bone conduction. I'm going to strike the tuning fork. I'm going to place it on your mastoid bone behind your ear. You let me know when you can no longer hear that, and then I'm going to place it in front of your ear, and you let me know when you can no longer hear that. Yes. Yes. All right, that was good. Air conduction was heard twice as long as bone conduction. Now we are going to move along to the nose. Upon general inspection of the nose, or wait, I'm going to test the olfactory nerve first before I even look at it. I want you to close your eyes and I want you to smell. Smells like peppermint. Right? That was testing cranial nerve 1, which is the olfactory nerve. Upon general inspection of the nose, I noticed there are no signs of masses or lesions or any drainage, sores, or abnormalities. I'm going to palpate the nose for any tenderness, masses, or lesions. I'm going to look inside the nose. The mucosa is pink and moist. The septum is midline and intact. No signs of perforation or bleeding. The turbinates are the same color as the surrounding tissue. Now I'm going to test patency of each nostril. I want you to hold one side of your nose and breathe. Hold the other side and breathe. Alright, patency was clear on both sides with no signs of obstruction. Now I'm going to move along to the mouth. Upon general inspection of the mouth, I'm looking at the lips. I don't see any signs of, they are pink and moist. I don't see any signs of cracks, lesions, or sores. I'm going to look inside your mouth. I'm making sure that inside the mouth it is pink, moist, and intact. The mucous membranes and buccal mucosa are pink and moist with no lesions. The pharynx is pink and moist. The tongue is pink, slightly rough, symmetrical, and freely movable. Lift your tongue up. The ventral surface is smooth. The frenulum is intact and centered. Wharton ducts are apparent on each side. The gums are pink and moist, and they fit tightly around 28 pearly white teeth with slight wear. The hard palate is intact, and the soft palate extends posteriorly from the hard palate. The anterior and posterior pillar presents are intact. The uvula is at the back of the mouth. It is midline and pink. There are no tonsils and no mouth odor. Now we are going to test cranial nerves 9 and 10, the glossopharyngeal and vagus nerves. And I'm going to do that by doing the gag reflex and have her say ah. I want you to say ah. Ah. Good. The uvula rises symmetrically with the soft palate. Swallow. Good. Both are normal. Now we are going to test cranial nerve 12, which is the hypoglossal nerve, and I'm going to have her do some tongue range and motion. Can you stick your tongue out? Up and down, side to side. Right? I want you to push against your cheek. Good. Now we are going to move along to the neck. Upon general inspection of the neck, I noticed that the neck is smooth, supple, no signs of extra pulsations, jugular vein distension, or any thyroid goiters. We're going to do some passive and active range of motion with your neck. I want you to move your head forward, back, side to side. I want you to look over each shoulder. I want you to shrug your shoulders. That is testing cranial nerve 11, which is the accessory nerve. I want you to push your head forward against my hand, back, side, the side. All of those are done smoothly without any pain. Now I'm going to palpate the carotids one at a time. The trachea is midline with no deviation. Swallow. That is testing the thyroid, and it does move smoothly up and down. Now I'm going to palpate some lymph nodes. Posterior auricular, preauricular, occipital, parotid, tonsillar, submental, submandibular, superficial cervical, deep cervical, posterior cervical, and supraclavicular. Good. Now I'm going to listen to the carotids and thyroid using the bell of my stethoscope. I want you to take a deep breath in and hold it. Okay. Take a deep breath in and hold it. Breathe normally. No bruise were heard. Now I'm going to look at the upper extremities, arms, and hands and fingers. They are equal in length and size. I don't see any signs of masses, lesions. The muscle distribution is even and equal. The hair distribution is even and equal. Clean, dry, and intact. I'm going to palpate for any tenderness, masses, anything. All right, I'm going to look at your nails. Capillary refill is less than 3. The nails are hard and smooth. No signs of cyanosis, clubbing, or splitting of the nails. Good. Now we're going to move along to the posterior and lateral thoracic. I want you to turn around on the back of the table. Upon general inspection of the back, I'm making sure that it is uniform with the rest of the body, clean, dry, and intact. I don't see any signs of masses or lesions. Thoracic configuration, the AP diameter is less than the lateral diameter, which is normal. I'm going to palpate for any masses or lesions. Any tenderness?
No.
Okay. I'm going to percuss the costovertebral angle for any pain or tenderness. Any tenderness or pain?
No.
Good. Looking at the lungs with respirations, I noticed that the rate and expansion are equal. The rhythm and rate are equal and even. The chest rises and falls with each breath, and the posterior chest rises and falls with each breath. I don't see any signs of dyspnea or accessory muscle use. Now I'm going to check expansion as you're leaned over. I'm going to place my hands on your back, and I want you to take a deep breath in. All right? And my hands move bilaterally symmetrical out when she took a deep breath. Now I'm going to palpate for tactile fremitus, and I'm checking for any increased or decreased fremitus, and I'm comparing each side bilaterally. As I place my hands on your back, I want you to say 99.
99, 99, 99, 99, 99, 99, 99.
All right, fremitus was symmetrical. Now I'm going to percuss for resonance and equality, and I'm comparing each side. Good. Now I'm going to test the diaphragmatic excursion, and I'm going to have you lean over, and I'm going to have you take a deep breath in, and I'm going to be listening for dullness. I would mark that spot, and now breathe. I'm going to have you take another deep breath in, and I'm going to percuss upwards. I'm listening for the change in sound from dullness to resonance, and I would mark that spot, and now I'm going to measure. And that is between 3 and 5 centimeters, which is normal. Now I'm going to auscultate the posterior and lateral thoracic, and I'm listening for any wheezes, rails, rhonchi, or crackles. Take a deep breath. No adventitious breath sounds were heard. Lungs were clear to auscultation. So we're going to have you turn around again, and I'm going to look at the anterior chest, heart, and lungs. Upon general inspection of the anterior chest, I'm making sure that everything is uniform with the rest of the body. The color is uniform, clean, dry, and intact. I don't see any signs of masses or lesions. I don't see any signs of heaves, thrills, or any extra pulsations. I'm going to palpate for any masses or lesions. Any tenderness? Right? I'm going to place my hand over the precordium, and I'm feeling for any thrills, heaves, or pulsations. I didn't feel any. So now I'm going to check the apical pulse, which is the mid-clavicular line, 5th intercostal space. Good. Looking at the chest, I noticed that the respirations are unlabored. The rhythm and rate are even and equal. Now I'm going to do some tactile fremitus, just like I did on the back side, and I'm looking for any increased or decreased fremitus. And as I place my hands on you, I want you to say 99.
99, 99, 99, 99, 99.
All right, and I was comparing each side bilaterally, and the fremitus was symmetrical. Now I'm going to do some percussion again, and I'm checking for any resonance and equality, and I'm comparing each side bilaterally. And the fremitus or resonance and quality were heard. So now I'm going to listen to the anterior chest. Listening for any crackles, wheezes, rails, or ronchi, or any adventitious breath sounds. All right, lungs were clear to auscultation, and now I'm going to listen to the heart tones. The aortic, pulmonic, Erb's point, tricuspid valve, and the mitral valve. And there were no murmurs or extra heart tones heard. Now I'm gonna have the patient lay down, and I'm going to look at the abdomen. I'm gonna go ahead and have you raise your shirt up. Upon general inspection of the abdomen, I noticed that the skin and color are uniform, clean, dry, and intact. I don't see any signs of masses or lesions, any signs of herniations, pulsations, or extra movements of the abdomen. The umbilicus is midline. I'm going to look at the contour from the side. It is flat and no abnormalities seen. Now I'm going to auscultate the abdomen, and I'm listening for breath sounds in each quadrant every 5 to 10 seconds. Now I'm going to listen to the arteries in the abdomen, and I'm listening for any bruits. The aorta, renal, iliac, femoral, and no bruits were heard. Now I'm going to do some percussion, and I'm listening for tympany over the abdomen and dullness over the organs. Good. Now I'm going to check for liver dullness. I would mark the area, and I would mark the area as I heard dullness again, and that was between 6 and 12 centimeters, which is normal. And now I'm going to have you turn over to your right side, and I'm going to be listening for splenic dullness. Mark area. Good. Mark the area. Now, I'm going to have you lay on your back, and I'm going to do some light palpation, and I'm checking for any tenderness or rigidity or any masses. Now I'm going to do some deep palpation, and I'm checking for any tenderness or guarding. I'm going to deeply palpate the liver. I'm going to come around on the other side so you can see. I'm going to have you take a deep breath in and palpate the liver. All right. I'm going to attempt to palpate this spleen, but it is normal if you can't. All right. I'm going to palpate each kidney and the aorta. All right, I'm going to have you set up, and as you're setting up, I'm going to look at your stomach muscles to make sure they are intact and symmetrical. All right. Now, looking at the lower extremities, the legs, and the feet, I'm noticing that they are equal in length and size. The muscle distribution is even and equal. The hair distribution is even and equal. I don't see any signs of edema, masses, or lesions. Any tenderness? All right. Capillary refill of the toes is less than 3. They are hard and smooth. I don't see any signs of cyanosis, clubbing, or splitting of the nails. I'm going to check some pulses. Popliteal pulse, dorsalis pedis pulses, and the posterior tibial pulses. All of those are +2 and normal. Now I'm going to check some reflexes. You lay your arms out. I'm going to test the brachial reflexes. Right. The popliteal, the Achilles. All right. Now I'm going to move along to the musculoskeletal section, and I want you to squeeze my hands, push against my hands with your legs, pull, push, push, pull with your feet. Good. Now I'm going to have you stand up, and we are going to check knee hip flexors, and I'm going to have you squat. All right. Now I'm going to have you bend over, and I'm going to look at your spine to make sure it's in line. I don't see any signs of scoliosis or kyphosis, and the hips are aligned. You can stand back up. I want you to bend backwards, side to side, and I want you to twist. And all of those are done smoothly without any pain. So I'm going to go ahead and have you sit back down. And that was the full head to toe assessment video.